Yeah, come to talk about the chemo side effects. Janine had everything. Everything you could possibly have as a side effect, Janine had it. Constant nausea. She was just throwing up like 25, 30 times a day. She would just sip water. Just a little sip of water would be enough for her to start throwing up everything. So, of course, she was losing weight. She lost like 10 to 12 pounds. And if you only weigh like, I don't know how much she weighed back then, especially not in pounds, because we have kilos and stuff over here. But she literally lost half of her weight. She had tiny arms. They were like this big. And her face was like, she just looked like a skeleton. It was crazy. I was feeding her anything she would eat. She had to take cortisone, I think that's what you call it, which made her really hungry. That was a good thing. So between the days she was just throwing up, she would be really hungry, and she would wake up at 2 o'clock in the morning, Mom, I want French fries. It was all because of the medicine. So it's like, Mom, I want French fries. I'm like, okay, it's 2 in the morning. I'm trying to sleep. You want French fries? Yes, I want French fries. So what do you do in that situation? You get your butt in the car at 2 o'clock in the morning, go to McDonald's or whatever, and you're going to get French fries. So, yeah. So that kind of helped her not really lose way too much weight. Yeah, the hair loss. She had no hair left after a few weeks. It just kept getting thinner and thinner and thinner, and then she had no hair whatsoever. The funny part is she didn't lose her eyebrows that much, a little bit, but they weren't all gone, and she didn't lose her lashes at all. So that was kind of good. Because it looks kind of freaky if you don't have lashes or an eyebrows or nothing. It makes you look weird. So, I mean, it was weird enough for a kid not to have hair, but her still having her eyebrows and her lashes made it not as weird. Yeah, the worst part, the really, really bad thing, which made the doctors even let us get the chemotherapy even later. We had to wait for a couple of weeks because Janine was just so sick. She had bleeding and open mucous membranes, like all of them, in her mouth, in her intestines, even her vagina. Everything that had this kind of a tissue was open and bleeding. Just because chemotherapy kills the fast reproducing cells. And in the body, besides the hair and the tumor, sorry. The mucous membranes are the fastest reproducing cells we have in our body, so it was just destroyed. She was just in so much pain. She couldn't even open her mouth. She couldn't even talk at times because it just hurt her so much. I mean, her lips up here in front, they were just cracking open. She would move her lip, just go like something like that. It would just bust open and start bleeding. That was the worst part ever. They put her on so much pain medication and just to soothe her and make her calm down that she was asleep like constantly, which was good because it was horrible. It was really bad. I mean, everybody that has a daughter knows if they have a diaper rash or something down there, it's bad enough. They'll complain and say it hurts, but if there's just one big, I'm sorry I have to say it like this, but it's just the way it was. It was just one big bloody glob down there. It was just, everything was just open and just, ugh. When I think about it, ugh, it was horrible. Yeah, so that was probably the worst side effect. Yeah, and of course she didn't have an immune system after that anymore. So it was just, she had 400 Leukozyten in German. It's the white blood cells. So normally you have like 14 to 15,000. So it was really low. So just a normal common cold that somebody brought into the hospital could literally kill her. So that's why we were locked up in our room. Nobody was allowed in, nobody was allowed out. They asked me if I wanted to stay in or out. And of course I said in, but that made me a prisoner with her. So not even Marcus could come in for a couple of days. It was no way, no way. You were not even allowed into the whole ward, I think that's what you call it, Station in German. You weren't even allowed to go up there unless you got checked out by a doctor, just making sure you're not sick. Because like I said, anything, even a little, I don't know, cough could just kill a kid in there. So it was really important. Yeah. The really bad part, which made me freak out, I was screaming at one point, was that going through all these chemo side effects and just seeing Janine laying there in pain, not feeling well, and just not doing so well. Well, the results for the MRI a couple of weeks later was that the chemotherapy wasn't doing crap to the tumor. It was just the way it was before chemotherapy. It didn't do anything. So it was totally unnecessary. I didn't know how to react, seriously. I mean, the whole time going through all of that and seeing my daughter, just seeing her the way she was, the one thing that kept me going in the back of my mind is the tumor will go away. The tumor will be smaller. It will stop compressing her lung. It will stop compressing her spinal cord. It'll help her. And it didn't. Yeah, so, yeah. The doctors were starting to talk about giving her more and stronger chemotherapy, and that's when I said no. Nuh-uh. I want to be sure that the next chemotherapy that's actually destroying my child, which it wasn't the cancer. You have to think about it like that. The thing making her not feel well was not the cancer, it was the chemotherapy. Because before chemotherapy, she was fine. So, you have to kind of think about, is it worth the risk? Because a child that only has 400 white blood cells, that all mucous membranes are open and wound and whatever, you really start thinking about stuff like that. And the doctor said, no, we'll just take a break and we'll talk about it. You guys can go home. So we got to go home finally. Oh, it was so cool. I know people think you're so out of your mind, but if you were in the hospital for 2 months, you'll be so happy about going home. Yeah, sleep in your own bed, take a shower in your own shower, being able to sleep without beeping everywhere, or being able to sleep without the cleaning lady coming in at 6 o'clock in the morning, or a nurse coming in to weigh your daughter at like 6:30 in the morning, and all that's just not going to happen at home. So we were thrilled. Yeah, I said all that. Okay. Yeah, going home was good, was great, but it kind of got me thinking about all of what happened. I mean, the whole time, like I said before, you were just totally functioning, and you were just working on getting through day by day, and all what that was in your head, all you were thinking about was next chemotherapy, her weight, is she going to throw up today? How's her body doing? I mean, what do we got to watch out for? How many, all the numbers, that was crazy. Every blood test, she had a blood test done every day. And all I could think about was, hopefully she has more than 600 white blood cells so we could go home. Because everything under that would just, not going to happen. So that's the only thing you would think about all day. So when I got home, all of that was gone. Well, not gone, but you didn't have to worry about it day to day. So I got to kind of think about our feelings and how Janine feels and everything. And I talked to her a lot, and the thing most worrying her is that she saw quite a few. I mean, in the time we were in there, it was 3, and after that, it was even more. She saw friends pass away. With friends, I mean little kids that are like 2, 3, 4, 5 years old. And some of them had neuroblastoma too. So she was like, Mom, am I gonna die too? How do you talk to a 3-year-old about stuff like that? I mean, you can't say, no, you're not gonna die. Of course you're not gonna die. You don't know that. And I'm not gonna lie to her, you know? I think that would be the worst thing to do, is that kids are not stupid. Even at the age of 3, they're not stupid. You're not going to be in the hospital and worry about her and giving her all this stuff and go crazy if nothing can happen to her. I mean, why are you doing it if it's perfectly okay to have cancer? So I talked to her a lot. I told her there is a possibility that she could die, but everything is fine right now. She's doing okay. She feels better since she didn't get any more chemotherapy. So there's no reason to believe she's going to die right now. So yeah, and it was hard talking to her about her friends that passed away because, I don't know, sometimes I felt like we were the only people there. We went into the hospital, got to know a couple of families. 2 weeks later, family A loses their child and they leave. A few weeks later, family B loses their child and they leave. So it's like, are we the only constant people in there? I mean, we weren't. There were quite a few other people that kept going in, but these devastating deaths of little children is what will stay in your mind. So we talked a lot about that. And I think that the worst part for me was the fact that parents are parents to protect the child, to do everything they can so the child is okay, does well, gets everything it needs. With everything, I don't mean food and clothes and not just that, but I mean love and protection, and give the kid the feeling that nothing can happen to them because mom and dad are here to take care of you. And I couldn't do that. I mean, my child was dying. Sorry. It was just so hard for us to cope with the fact that if this disease, if this illness wants to kill our child, there isn't crap we can do about it. Nothing. It's not like when it's cold outside, oh, put a hat on, put a scarf on, that'll protect you from the cold. You know, there's something you can do about it. But in this case, you can't. You just can't. And that was the worst thing. I mean, she was 3 years old and she was losing that, let's just call it perfect world image. I don't know, you know what I mean? Just like everything's fine and my mom and dad are here for me, and if something happens, I'll just go to them and they'll make it all go away, or I can take care of a problem myself or something. And nobody can do anything about it. If your child has cancer, sure, you can get a treatment or whatever, but it's not like they can say, okay, like a cold, just get some medicine and you'll feel better afterwards. You know what I mean. I don't have to explain it. That was and still is the worst thing for us.